If you're pregnant or have been pregnant before, you've probably heard of Braxton Hicks contractions. They're one of those things that can be both confusing and concerning, especially if you're not sure what's happening. But don't worry, you're in the right place. In this video, we're going to go over everything you need to know about Braxton Hicks contractions, from what they are, what causes them, and how they feel, to how you can differentiate them from labor and manage them at home, and finally, when you should talk to a doctor. So, let's dive in. What are Braxton Hicks contractions? Braxton Hicks contractions, also known as practice contractions, are mild, irregular contractions that can be felt during pregnancy, and they can be mistaken for true labor contractions. You might hear them referred to as false labor because they can sometimes feel similar to real labor contractions, but they don't mean that you're actually going into labor. Instead, they are your body's way of preparing for labor. They act as a warm-up, helping the uterine muscles strengthen and get ready for labor. They typically begin during the second trimester, though some women might notice them as early as 16 weeks into their pregnancy. They become more noticeable and frequent during the third trimester, particularly in the final weeks before delivery. Unlike true labor contractions, Braxton Hicks contractions don't cause the cervix to dilate and are not a sign of labor starting. They may come and go, lasting anywhere from 30 seconds to 2 minutes, and are known for being unpredictable. Many women describe Braxton Hicks as a tight or squeezing sensation in the abdomen, similar to a muscle cramp but located in the belly. These contractions are named after Dr. John Braxton Hicks, who first described them in the late 1800s. Causes of Braxton Hicks contractions. Now you might be wondering why these practice contractions happen in the first place. Well, here are some of the most common causes. Number 1. Dehydration. When your body doesn't have enough water, it can lead to muscle cramping, including in your uterus. Dehydration is one of the most common triggers for Braxton Hicks contractions, so it's important to drink enough water throughout the day, especially during pregnancy when your body needs extra hydration. Number 2. Physical activity. Being physically active can sometimes trigger Braxton Hicks contractions. This could be anything from going for a long walk, climbing stairs, or just being on your feet all day. However, these contractions usually go away once you rest. Number 3. A full bladder. Believe it or not, having a full bladder can trigger Braxton Hicks contractions. The pressure from a full bladder can irritate the uterus and cause it to contract. It's a good idea to empty your bladder regularly to help reduce this trigger. Number 4. Baby's movement. The baby's movements can also cause Braxton Hicks contractions. When your baby moves or stretches, it can put pressure on the uterus, leading to a tightening sensation. This is a normal response and usually doesn't last long. Number 5. Stress and fatigue. Stress and fatigue can increase the likelihood of experiencing Braxton Hicks contractions. When you're feeling stressed or exhausted, your body releases certain hormones that can lead to muscle contractions. Taking time to relax, rest, and practice stress-reducing activities can help minimize these contractions. Number 6. Sexual activity. Sexual intercourse can trigger Braxton Hicks contractions. This is due to the release of the hormone oxytocin, which can cause the uterus to contract. These contractions are usually harmless and temporary. Number 7. Overheating. If your body temperature gets too high, it can sometimes trigger Braxton Hicks contractions. This might happen if you're exercising in hot weather or spending time in a hot bath or sauna. It's important to keep cool and stay hydrated to avoid this trigger. Symptoms of Braxton Hicks contractions. Braxton Hicks contractions can vary quite a bit from one person to another, and even from one pregnancy to the next. For many people, they feel like a tightening or hardening of the abdomen that comes and goes. You might notice your belly getting really tight for a minute or two, and then it relaxes. Unlike real labor contractions, Braxton Hicks are usually painless or only mildly uncomfortable. Some people describe them as feeling like menstrual cramps, but they're generally less intense than true labor contractions. What's important here is that these contractions are usually irregular, meaning they don't come at consistent intervals, and they don't get progressively stronger or closer together like true labor contractions do. You might have one Braxton Hicks contraction, then another an hour later, and then nothing for the rest of the day. They also tend to go away if you change your activity, like sitting down if you've been standing, or drinking some water if you've been active. Another thing to keep in mind is that Braxton Hicks contractions tend to be felt in the front of your abdomen, while true labor contractions often start in the lower back and move to the front. If you're feeling a lot of tightening and you're not sure whether it's Braxton Hicks or something else, paying attention to the location and intensity can help you tell the difference. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Braxton Hicks versus true labor contractions. It's totally common and understandable to be confused about whether what you're feeling is just Braxton Hicks or labor. Here are a few specific points to help you differentiate between Braxton Hicks and true labor contractions. Number 1. Timing and pattern. Braxton Hicks contractions are irregular with no consistent pattern. You might have several in an hour, then none for hours. Real labor contractions, however, follow a predictable pattern. They become more regular, frequent, and closer together as labor progresses. So time your contractions from the beginning of one to the beginning of the next. If they're becoming steadily closer together, this could indicate real labor. Number 2. Intensity. Braxton Hicks contractions are usually mild and painless. They may be uncomfortable, but they don't usually increase in intensity. In some cases, they might feel strong one time and mild the next. In real labor, on the other hand, contractions get stronger or more painful over time. Each contraction builds in intensity compared to the previous one, creating a clear progression that you can track. Number 3. Location of pain. Braxton Hicks contractions are typically felt in the front of the abdomen, while labor contractions often start in the lower back and wrap around to the front, creating a wave of pain. Number 4. Response to movement. Braxton Hicks contractions often fade when you change positions, rest, or drink water. Labor contractions persist regardless of changes in movement or rest. Number 5. Other symptoms. True labor contractions often come with other physical signs that Braxton Hicks don't have, such as lower back pain that comes and goes with the contractions, a feeling of pressure in your pelvis, and water breaking, though this doesn't always happen early in labor. Home remedies for Braxton Hicks contractions. Luckily, there are some practical things you can do at home to ease the discomfort and help prevent them from becoming too frequent. Number 1. Stay hydrated. Staying well hydrated is crucial for managing Braxton Hicks contractions. Aim to drink at least 8 to 10 glasses of water daily. Keep a large water bottle with you at all times and sip consistently throughout the day rather than drinking large amounts at once. If plain water becomes boring, try adding slices of lemon, cucumber, or berries. Some women find that warm water with honey can be particularly soothing during contractions. Number 2. Change your position. When Braxton Hicks contractions start, try changing your position. If you're standing, sit down or lie on your left side. If you're sitting, try walking around gently. The key is to move slowly and deliberately. Practice different positions to find what works best for you. Many women find that lying on their left side with a pillow between their knees provides significant relief. Number 3. Relaxation techniques. Deep breathing exercises can help manage discomfort and reduce anxiety. Try inhaling slowly through your nose for a count of 4, holding for 2 counts, then exhaling through your mouth for 4 counts. Combine this with progressive muscle relaxation, which is simply systematically tensing and relaxing different muscle groups from your toes to your head. Number 4. Take a warm bath. A warm, not hot, bath can help relax tense muscles and ease discomfort. Keep the water temperature comfortable but not too warm. Around 98 to 100 degrees Fahrenheit is ideal. Alternatively, apply a warm compress to your lower back or abdomen. Some women find relief from alternating warm and cool compresses. Number 5. Avoid overexertion. It's important to avoid overexertion. If you're feeling a lot of Braxton Hicks contractions, it might be your body's way of telling you to slow down. Listen to your body and take breaks when you need them. Resting and practicing self-care can go a long way in keeping these contractions under control. Number 6. Empty your bladder. Emptying your bladder frequently can prevent Braxton Hicks contractions from becoming uncomfortable. A full bladder can put pressure on the uterus, which may trigger contractions. By going to the bathroom regularly, you can reduce this pressure and make the contractions less noticeable. When to talk to a doctor. Braxton Hicks contractions are usually nothing to worry about, but there are times when it's important to reach out to your doctor. If you notice contractions that become increasingly painful and regular, or more than 4 contractions per hour before 37 weeks of pregnancy, it's a good idea to consult with your doctor. Additionally, if you experience other symptoms like lower back pain, pressure in your pelvis, vaginal bleeding, or a sudden gush of fluid, which could indicate your water has broken, it's important to seek medical attention right away. In many cases, it's always better to ask and have peace of mind than to worry about something that might need medical attention. Now, we want to hear from you. Have you experienced Braxton Hicks contractions during your pregnancy? What helped you the most in managing them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.